Now, so before we go to the two representatives of VAC4EU, which are Susanna and Felipe, indeed the PI and the data expert, I would like Emilie to speak a bit. And Emilie is the assistant professor and the European director of the Vaccine Confidence Project at the London School of Hygiene. We've seen that. She's a senior social scientist with more than 10 years of experience in international research and teaching in academia. She has a background in public health, infectious disease control, and health system and policy research. So, please. It does work.
It does work.
It's
it will
strange.
start. It will start at some point. Okay. So I think, well, you've already heard about vaccine confidence from Heidi this morning, so I'll try to bring a little bit different information. But I think I'd just like to say that, to start by saying that I've actually started working in this field, and Advance was my very first project working together with Heidi, so this is very close to my heart as well, and it brings back a lot of memories, good memories. But when thinking about sort of what, lessons learned from the past, I don't think I should go back all the way to Advance, because things changed so much. So I think we have to be really up to date with the latest changes, and so I'll try to reflect a bit more on the last few months, last few years, and what that means for real-world evidence and the work that you do. So I think at the moment, what I think the most important message is that evidence in itself is not enough. We need more than that. Data in itself is not enough. What we've been seeing, I cannot talk about confidence without anyone in the room not expecting me to mention the US and what's been happening in the past few months, sorry. But I think what we're seeing in the US is very different from past crises that we've seen. It's not just a vaccine debate. It's really a shift, a political shift that we're seeing, and it's about how vaccine decisions are made. It's no longer about vaccines decisions being influenced by data, by public health, by science, but it's decisions being made influenced by political identity. And we've been warning about this, we've been talking about the risks of that for a long time, and this is happening now. The risk for the US in Europe, for Europe, of what's happening in the US, is not just about copying what's happening there. That's not really it. The risk that we have is that we copy the logic of what's happening there. So it's the idea that vaccine recommendations are political choices rather than evidence-based, rather than based on data and real-world evidence. And once that door opens, it's going to be very difficult to close it. And unfortunately, we're already seeing it happening in some countries, with what's been happening in Italy, although avoided, thankfully, but also with groups having conversations about anti-vaccination stands in the European Parliament in the past few weeks. So there's already a lot happening. And it's no longer about individual confidence. One of the points that I often make in these presentations is that we have to think about people. Vaccine confidence is about individuals. It's about, in a way, and I was talking to Eva about this, I really hate that people talk about anti-vaxxers, about anti-vaccination, and polarize this conversation even more, because it's not about that. It's about the fact that everyone has the right to have questions about vaccination. They want to make informed decisions with the information that they have, and it is a very difficult thing to do for people. When you think about all the science, all the data that comes into making recommendations about vaccination, imagine what that means for parents. So it's normal for people to have questions, and that's normally what I say. But I think today we have to go beyond that. It's no longer about the individual. It's about organized networks that we're seeing shaping professional and political influences. And that's where we really need real-world evidence to come in. Because generating robust vaccine safety and vaccine data is just half of the equation. The other half is whether people will actually trust the system that analyze and communicate that data. And if trust collapses, then evidence loses its power. So we've been trying to build trust in an environment another important point that I want to make is the environment has changed enormously in terms of information. And you mentioned this with AI, and we've seen this with confidence as well. Recently I was at a doctor that asked me whether he could use AI in a different way. They was actually looking at vaccine recommendations. I was about to travel, and they didn't have the information about which vaccines I should be taking for where I was going. So they asked ChatGPT. It's like, which vaccine should I give this woman? That's one side, but then more and more you read reports of people actually preferring AI tools to doctors because they have more emotional connections and conversations with AI tools, because doctors don't have time. As you said, they use AI to summarize their notes, and they feel more connection to tools like ChatGPT that are learning to become more and more emotional. So we have to understand that the way we're trying to build trust is happening in a new information environment. And we talked a lot about misinformation, and Heidi talked a lot about misinformation, but it's not just about misinformation as well. It's about the emotional appeal of misinformation. What misinformation does very well is that it really triggers our fears, our hope, our sense of belonging to certain groups, and that's what we have to be worried about. But that's also what we have to learn from. And I think one of the main messages that, don't abandon science. We have to use data, we have to use evidence, but try humanizing it. Try making it more personal, more emotional, so that it makes sense, that sense of belonging, that sense of recognition, that people can actually feel connected and understand why they need certain vaccines and why it's good and safe for them, for example. And I think the good news is that, platforms like VAC4EU really are helping in that, because they can generate that high quality data, the evidence and transparency. But I would like our communication system to be to that level as well, that we have that type of collaboration for confidence monitoring, trust monitoring, for communication, that we make sure that communication and safety monitoring, and confidence monitoring is treated as importantly as safety monitoring. And we also need to think about being proactive rather than reactive. A lot of the time, what happened during COVID, we've seen that we didn't have data, there was a lot of uncertainty, and a lot of the communication was very reactive. So yes, there were preparedness plans, but they did not always help us. And we depended on people reacting to the information. I think that obviously needs to change, and we need to be better prepared. But we also need to understand, I think one example I want to give is the importance of experts taking stands. And I think I was at a meeting, I can't see Pierre anymore, but he was there earlier. We were at a meeting last week, and he mentioned something. One of the very good lessons from the pandemic was how many experts took stage, how many scientists were in front TV news, national TV news, radio. They were all over the place. But that's not the case anymore. So why did that stop? Where are the lessons learned from that? And I'll just finish, I think, by saying that, it kind of goes back to what Heidi was saying, but if the US is stepping back now as a global anchor in public health messaging, we need to make sure that somebody else takes that space. And I think Europe has not only an opportunity, but a responsibility to be that voice in terms of data management, data gathering, but also in terms of communication. And we have to show communication excellence, and the same way that vaccine systems and the strength of our vaccine systems depends not only on what we know, it depends as well on whether people believe it. And that's what matters most. So I think Europe has to be equipped and has to think about how to be better prepared, how to communicate better, and how to fill the gap that the US is leaving today. Thanks.